10 NCLEX practice questions you must know. Let's start with question number 1. A nurse assesses a client with rheumatoid arthritis who reports worsening joint swelling and tenderness. Which findings are consistent with rheumatoid arthritis? Select all that apply. A. Recent influenza infection. B. Limited joint movement. C. Excess salivation. D. Elevated blood pressure. Or E. Joint pain even when resting. The correct answer are B and E. These are the rationales. Limited joint movement occurs because rheumatoid arthritis causes joint inflammation, swelling, stiffness, and pain. Over time, this can reduce mobility and joint function. Pain, even when resting, can occur with RA because the inflammation is active, not only triggered by movement or activity. Let's go to question number 2. A nurse provides teaching to a client newly diagnosed with rheumatoid arthritis. Which statement should the nurse include? A. You may have stiffness when you first get out of bed. B. You may develop abdominal pain from the disease itself. C. You may gain weight as a direct effect of the disease. Or letter D. You may have episodes of low blood sugar. Okay, so the correct answer is letter A. And this is the reason. Morning stiffness is a classic finding in RA or rheumatoid arthritis. It often lasts longer than 30 minutes and improves with gentle movement as the joint loosens. Let's go to question number 3. A nurse reviews laboratory tests for a client being evaluated for rheumatoid arthritis. Which laboratory findings may support this diagnosis? Select all that apply. Letter A. Urinalysis. Letter B. Erythrocyte sedimentation rate. Letter C. Blood urea nitrogen. Letter D. Antinuclear antibody titer. Or letter E. White blood cell count. So the correct answers are B, D, and E, and these are the rationals. Erythrocyte sedimentation rate, or ESR, may be elevated because rheumatoid arthritis is an inflammatory disease. Antinuclear antibody titer may be positive in some clients with autoimmune disease, including rheumatoid arthritis, though it is not very specific to RA. And the last rational, WBC, or white blood count cell, may increase when inflammation is present, so it can support the overall clinical picture. Let's go to the next question, which is question number 4. A nurse is applying soft wrist restraint and ankle restraints for a client. Which actions should the nurse take first? Select all that apply. Letter A. Place the restraint above the IV insertion site. B. Secure all restraints to one side of the bed. C. Attach the restraints ties to a stable part of the bed. Or letter D. Keep the client flat in a supine position. Okay, so if you selected A and C, you got this right. These are the rationale for choice letter A. Place the restraint above the IV insertion site. This prevents the restraint from pulling pressure on the IV site and reduce the risk of IV dislodgement or impaired flow. Letter C. Attach the restraint ties to a stable part of the bed frame. Restraints should be tied to the bed frame, not the side rails. Side rails move and can cause injury or tighten the restraint. Let's go to question number 5. An older adult takes several prescribed medications. The nurse wants to reduce the client's risk for adverse drug reactions. Which action is the priority? Letter A. Complete a detailed medication and health assessment. Letter B. Teach the client about possible adverse drug reactions. Letter C. Explain that many older adults are hospitalized due to drug reactions. Or letter D. Teach that the risk of adverse drug reactions increases with the number of medication taken. Okay, so the correct answer is letter A, and this is the rationale. A complete and detailed medication and health assessment. So assessment comes first. Older adults are at higher risk for adverse drug reactions due to polypharmacy, altered metabolism, kidney changes, liver changes, and drug interactions. The nurse must first identify what the client takes, how they take it, and what symptoms or risks are present. Let's go to question number 6. A nurse assesses a client with uremic frost. This finding is most commonly associated with which condition? Letter A. Severe anemia. Letter B. Atherosclerosis. Letter C. Liver failure. Or letter D. Parathyroid disorder. Okay, so the correct answer is letter A, severe anemia, and this is the rationale. Uremic frost occurs in adverse kidney failure when urea builds up in the blood and crystallizes on the skin after sweating. Clients with advanced kidney disease often also develop severe anemia because the kidney produces less erythropoietin, which is needed to make red blood cells. Our next question. A client arrives in the emergency department after a motor vehicular crash. Assessment findings include blood pressure of 80/34, pulse rate of 120, and respiratory rate of 20. Which nursing diagnosis has the highest priority? Letter A. Altered cerebral tissue perfusion. Letter B. Fluid volume deficit. Letter C. Ineffective airway clearance. Or letter D. Altered sensory perception. So the correct answer is letter B, fluid volume deficit. The client has hypotension and tachycardia, which suggests potential blood loss and hypovolemic shock after trauma. The priority is to recognize and treat decreased circulatory volume before organ perfusion worsens. Airway is always assessed first, but the respiratory rate is 20 and there's no signs of airway obstruction in the stem. The most direct problem shown by the data is fluid volume deficit. Let's go to the next question. A client returns to the surgical unit after an exploratory laparotomy and bowel repair. The client has IV fluids infusing, an NG tube connected to low intermittent suction, and a Jackson Pratt drain. 4 hours later, the client reports nausea and begins vomiting. Which action should the nurse take first? A. Assess the abdomen for distension and bowel sounds. Letter B. Inspect the surgical dressing and Jackson Pratt drain. Letter C, check the NG tube for patency and assess gastric drainage. Or letter D, give the prescribed prochlorperazine for nausea and vomiting. Okay, the correct answer is letter C, and this is the rational. The client has an NG tube for gastric decompression. New nausea and vomiting may mean that the NG tube is blocked, displaced, or not suctioning. The nurse should first check tube patency, suction function, and the amount and the character of gastric output. Antiemetics may help symptoms, but they do not correct the cause if the NG tube is not working. Our number 9 question. A post-operative client has abdominal pain, abdominal distension, and has not passed lattice. The nursing diagnosis is pain related to decreased gastrointestinal motility. Which nursing intervention is most appropriate? Letter A, listen to bowel sounds. Letter B, measure abdominal girth. Letter C, place the client in a high Fowler's position. Or letter D, hold opioid pain medication due to slow bowel motility. Okay, the correct answer is letter A, and this is the reason why. The client shows signs of decreased bowel motility. The nurse should assess bowel sounds to determine whether peristalsis is present, hypoactive, or absent. Measuring abdominal girth may help track distension, but bowel sounds give more direct information about GI motility. Opioids should not be withheld without a provider order or a pain management alternative. Question number 10. A 22-year-old client calls the clinic reporting nausea, vomiting, and right lower abdominal pain. What should the nurse instruct the client to do? Letter A. Apply a heating pad to the painful area. Letter B. Drink at least 2 quarts of liquid to prevent dehydration. C. Take a laxative to help move the bowel. Or letter D. Seek medical evaluation right away. So you all the correct answer is letter D. And this is the rationale. Nausea, vomiting, and right lower quadrant pain may indicate appendicitis. The client needs prompt evaluation because rupture can lead to peritonitis and sepsis. The client should avoid heat, laxatives, and increase oral intake because this can worsen complications or delay treatment. If you like contents like this, please subscribe to the channel as I create more nursing contents to help nursing students pass their NCLEX. Thank you for watching.